Hello everyone, my name is Gail and I'm the school nurse for the ISD. The state of Michigan has made a new law this year that schools have to have 2 EpiPens in any building where there are students. One is going to be the adult EpiPen, which is the yellow one. The other is going to be the junior EpiPen. So those are different dosages according to the size of the student. EpiPen is used when there's an anaphylactic reaction. Sometimes we will know ahead of time that a student has an allergy. Sometimes we will not. If a student has an anaphylactic reaction, that just means that they're having a severe allergic reaction. Unfortunately, these can be fatal if not taken care of properly. So the law is requiring us to be prepared for when that happens. You may have a student in your building that doesn't even know they're allergic to, say, peanuts, or has never been stung by a bee and gets stung by a bee. They may have taken a new medication right before they left home, and it might be something that they're allergic to. Those are food, medication, and insect bites. Some people, even by the time they reach high school, have never been stung by a bee. And if the first time that they get stung by a bee is today, you may find out that they are severely allergic. The symptoms of an anaphylactic reaction are going to be, the most common one is difficulty breathing. So if you see a lot of swelling around the mouth or the neck, or the person is wheezing and gasping for air and they have just been stung, this is a very critical condition. What we're going to do is give them a shot of EpiPen, and while you are doing that, please send someone else to call 911. EpiPen does not replace a 911 call. It just gives the person a little bit longer until the ambulance arrives to give them more medication. Okay, so these are the 2 different kinds that we have, the adult and the junior. I'm going to look at the adult one today. They're just alike. So these boxes have 2 in it. I guess that's in case you have 2 students at the same time having a problem. What we're going to work on right now is the trainer. The trainer is a dummy. There's no needle in it, but it's just for you to learn on. Inside this box, there's also an instruction sheet. Words on one side and graphics on the other side. Excuse me. When you pull, the first day that you get your EpiPen, the first day that you see it, please check the expiration date. We just want to make sure that it has not expired. Okay. So you grasp the EpiPen, the trainer, and I want you to actually do this, please. Please open your container and get the one with the blue cap out with the orange tip. When you hold this, please make sure that your thumb and fingers are not covering either end. We don't want any accidents, any needles, so make sure that it's just being held within a fist. So with your thumb and first finger, just take the lid off, set it aside, and now about arm's length down, the outside of the thigh is the only safe place to administer this, and it's meant to go through the clothing. After we put it in, we're going to hold it in place for 10 seconds. Count along with me, please, while we do that. Ready? 1, 1,000, 2, 1,000, 3, 1,004, 1,005, 1,006, 1,007, 1,008, 1,009, 1,010. After you've administered the EpiPen, at that point you will want to massage the thigh to make sure the medication is being absorbed by the body. And at this point you will have had the opportunity to describe to the 911 dispatcher your situation, and they will give you any further instructions as far as anything that you need to be doing for the patient or the student between now and the time the ambulance arrives. Thank you so much. Feel free to call Greenfield School and ask for Gail if you have any further questions.